next speaker. I'm not sure whether she's in the room or not. Is it Alysha Bhatti? She is here. Thank you. Beg pardon. Alysha Bhatti is a project manager. Alysha, she's a project manager for, is it SHR? MedShare, Medical Communication App, and she's going to be talking about innovative communication apps for medical staff in hospitals. Please, Alysha.
Assalamu alaikum and good afternoon, everyone. Thank you very much for inviting me to speak today. Yes, my name is Alysha Bhatti, and I'm a final year medical student at Imperial College in London. I'm here today with George Ullman, who's the Partnerships and Operations Director for MedShare, and I'm going to be talking to you about this e-health app that aims to share knowledge and save lives. So I think it's quite useful for us to have a look at this document, the NHS's 5-year forward review, because the 70th anniversary of the NHS is coming up soon next year. And what this document looks at is the journey that we've had in improving quality of patient care and what we can do in the future. And one of their key recommendations is for us to harness technology and innovation for the benefit of patients, the public, and clinicians alike. So in this vein, it's useful for us to look at how much we actually rely on such technologies, and in particular, smartphone usage. So this is some of the findings from a study that was carried out in BMJ Innovations. And what they found is that around 2/3 of doctors utilize messaging services, things like text or WhatsApp or picture messaging, to share patient-related information. And yes, this is convenient for learning, but importantly, it contravenes the key principles of GMC guidance and the duties of a doctor, and it has the potential to breach patient confidentiality. So we all rely on medical apps on a daily basis, but what this study showed is that around 70% of doctors expressed a desire for a secure interface to share patient-related information to aid learning and clinical decision-making. So what it shows is that there really is a deficiency in the market, and an easily accessible and secure interface is needed to help us learn and to help us improve patient care. So in this respect, how can MedShare help? Well, MedShare is an app as well as a web platform, and it facilitates case-based discussion. And this is for doctors, for medical students, healthcare professionals, physician associates, everyone. And the aim of MedShare is that we can advance patient care through learning, and also because it acts as a tool and a platform for teaching and reflective practice. And ultimately, the aim of MedShare is that by connecting colleagues in this secure, pan-specialty global professional network, that we can help to improve the care of our patients and help to save lives. So how does MedShare work? Well, MedShare can be downloaded for free from the App Store and Google Play. Users can then create cases and tag them with the relevant specialty. And cases can be anything from a clinical image through to blood results, radiology images, or surgical footage. Users can then share this with their colleagues and generate discussion, and this will really help to inform patient management. And finally, one of the real benefits of MedShare is that through this global network, that you can really extend your reach and connect with colleagues. MedShare can also be used to export cases to your e-portfolio to support specialist accreditation, as well as for appraisal purposes. So how does MedShare ensure this confidentiality and this privacy? Well, the first thing is consent. So there is a unique in-app consent system for patients to use in a transparent process before their data is used on MedShare. Secondly, confidentiality. So there is an anonymity tool which enables users to blur out distinguishing features, and this will help to preserve the patient's privacy. And finally, control. So MedShare contains a large cloud encrypted storage space, and this means that no patient data will be recoverable from the device.
2 minutes.
And these three elements together mean that MedShare complies with information governance standards. So in the last 2 years since MedShare's launch, it's grown considerably. There are now 330,000 members worldwide. And who are these members? Well, they come from all training levels: senior doctors, junior doctors, medical students, healthcare professionals, dentists. And it's also gained particularly rapid growth in the Middle East and Asia. There are currently 24,000 members in Pakistan alone. If we look at cases by specialty, you can see that general practice, most of the cases are tagged by general practice, followed in close succession by radiology, as well as peds and trauma and orthopedics. So how is MedShare making a difference on the ground? So I'd like to share with you a few case vignettes. The first one is of a lady who presented with severe diabetic foot complications to a rural clinic in Lamu in Kenya. And the doctors looking after her were part of this Doctors of the World group on MedShare. And through this, we're able to connect to UK specialists, so UK general surgeons, UK plastic surgeons, and therefore gain valuable input regarding wound management, amputation options, and then subsequent follow-up. And this really shows how MedShare is able to upskill those working in remote areas. The second case concerns a GP working in a refugee camp in Serbia. He was presented with a young man with these characteristic skin lesions that you can see here. The GP made the diagnosis of psoriasis vulgaris with the patient's consent, uploaded the case to MedShare, and was able to connect with dermatologists to confirm the diagnosis, to gain appropriate management advice, given the resources and given the circumstances that he was in. And finally, a case which I found particularly interesting, that of using MedShare to share rare cases like infective endocarditis, because it's very important for us to pick this up early to give the life-saving treatment. So what about the future of MedShare? Well, the future of MedShare envisages an expansion of the training resources, particularly at the postgraduate level, availability in different languages, the facility for secure messaging. As we've seen, it really has had an impact in improving the delivery of healthcare in developing countries, and we hope that this will be spread even further. And finally, MedShare has broadened its horizons in medical education as well as clinical practice through its numerous partnerships, and the hope is that these will expand on a local and global level. So ongoing user feedback has shown that MedShare really is a valuable tool in helping to revolutionize and really helping us to improve our practice through using clinical experience. And given the vast number of clinicians that are currently actively engaged in MedShare, it shows that MedShare has helped and hopefully will continue to help us better serve our patients. Thank you very much.
Thank you very much, Alysha. Thank you. I think if anyone has any questions for Alysha, as we're coming to the end, do you want to, Alysha? Can I summon you back, please? I think there is one question for you from Dr. Sohail Chugtai. Yep. Come on, yeah, come on, to the mic.
George Ullman to come up.
Yep, yep.
Very confidently, and we really want, first of all, I want to appreciate the way you present.
Thank you.
It's a tribute to developers. MedShare is certainly a good application. It sounds like I've used it myself. I see slight limitation of that in one way. There is a business B2C model. But if you consider that to be a B2B model and use hospitals as your customers, let them control who's going to use that. That could be one way of looking at it, because then they can control what goes on it rather than you. That's my comment on this.
Thank you. That's great to hear you're already on MedShare. We're starting to work with local trusts and GPs in closed groups for hospitals and GPs to discuss cases where it's led from, institutions. And we're also starting to work with medical educators to address that point. But really good to hear your feedback and thoughts. Thank you. George.
Okay.
Yes.
Okay. Do you want to say anything, Alysha?
No, I think George has answered very well, and given that one of our partners is Health Education England, we're hoping to inculcate a group of MedShare Health Education England fellows, which will hope to further that and inculcate that within the NHS. So, good point. Thank you, Dr. Shuktai.
Thank you very much, Alysha and George.